Hello, and welcome to the orientation overview for the public health program at Roger Williams University. This is a great time to become involved in public health. The COVID-19 pandemic has drawn the world's attention to the crucial need for a strong public health workforce, not only in healthcare, but also the wide range of other professions involved in disease prevention and health promotion. You'll learn about that wide range of professionals and expertise needed in public health if you take this course at Roger Williams. My name is Mary Beth McPhee. I'm the chair and a professor of public health. I have a background in medical anthropology with expertise in global health, health inequalities, and community-based approaches to health promotion. My goals for this presentation are to help you distinguish the different degree tracks in public health, to recommend some courses for your first year, and to point out ways you can get involved with public health activities on and off campus. Public health at Roger Williams offers 2 degree paths. All students will take a set of common courses together in the public health major. This includes the introduction to public health, called Public Health Essentials, epidemiology, global health, ethics, health policy, and there are 2 practicum requirements, one at the junior year and one at the senior year, which will be your last course. You have a choice between pursuing a Bachelor of Science degree or a Bachelor of Arts degree. Students who have stronger skills in the sciences and stronger interests in the sciences should choose the Bachelor of Science degree track. This track requires more lab sciences in biology and chemistry, and the math requirements are there's a higher level of expectation for advanced math, at least until Calculus 1, and students in this track will take biostatistics. The Bachelor of Arts track is better suited for students with stronger skills in the humanities and social sciences, and maybe have career interests in that side of public health. There are more expectations for courses in social and behavioral sciences, as well as different quantitative requirements from the BS track. Students in this track will take basic statistics for their math and can take quantitative analysis in either psychology or political science. In the Bachelor of Arts degree, you have 2 options for your electives. You can either pursue community and health equity, which is a little bit more focused on social justice and community engagement, or you can choose the health policy and administration track, which focuses more on sort of the macro scale of public health in using government and health administration to advance public health initiatives. So if you have chosen to pursue the BS track for your college degree, then we recommend that you start off with math, the highest level math that you can place in. So ideally that will be Math 213, which is Calculus 1. If you don't place into that course, that's fine. Just take whatever course you place into so that you reach the Calculus 1 level by the time you graduate. We also recommend that students start with chemistry, chemistry 191. You'll need to have at least pre-calculus level math placement to qualify for that. And if you don't, then put off taking chemistry 191 until a later semester. Writing skills are really important in public health. You're going to be doing a lot of writing. So we recommend getting started with college level writing in either Writing 100 or 102, and the writing guidelines from that department will help you choose which one makes the most sense for you. Getting started with your core introductory requirements is a great way to learn about the different kinds of other majors you might think about at Roger Williams, either combining as a double major or maybe a major minor combination or a major core concentration combination. Helps you get a feel of fields that are available for college study that maybe weren't available when you were in high school. You can take 2 core courses if you like, or you might think about starting an additional elective course maybe starting an introductory in another field that has sparked your interest in high school, or maybe something that you've wanted to explore in college. There's so many different opportunities available at Roger Williams where you can think about a nice complementary program that goes along with public health. We're so interdisciplinary that there are many opportunities out there for you to think about an additional elective. BA students should also think about taking math in their first semester. Math 124 Basic Statistics is our required course. If you place into college algebra, I would recommend taking that before taking basic statistics. But if you're at the pre-calculus level for your placement, then go right ahead and take basic stats. We also recommend that BA students should take Psych 100. This is Introduction to Psychology. This is a great preparation for our Public Health Essentials course, which you can take in your second semester at Roger Williams. Similar to the BS students, we recommend that you get started with your writing requirements because the BA students, even more than the BS students, will be doing a lot of writing. So it's a good idea to build those skills right off the bat. For the core requirements, Core 101 is a really good idea for Bachelor of Arts students. The sciences are so important no matter which degree track you pursue. And Core 101 is a great way to get a start in the sciences at the college level to help prepare you for Bio 103, which is a required for the BA students. We just recommend that you put that off until your sophomore year. And then similarly, you should think about an additional elective course in a field that interests you. The languages are often a good idea, but also political science might be something you want to think about if you're interested in the health policy and administration elective area for the Bachelor of Arts. There are many opportunities that are available to you, so take a look at what's on offer. So you can switch between the BA and the BS once you get started if you decide that it's not right for you. But it's a good idea to sort of get a feel for which direction you want to go right off as your starting classes in the fall. So you'll realize that none of those courses I recommended for your first semester are not called public health. Right? None of them say public health in the title. That's because we put that off until at least the second semester of your freshman year, and some students even wait till sophomore year. But there are plenty of ways to get involved with public health on campus and off in your first year at Roger Williams. There are a number of clubs and activities that are popular with public health students, and the first most important one is the Public Health Club. This is run entirely by students in the major and the minor. We will get your names to the club officers at the beginning of the fall semester so that they can get in touch with you. They meet on campus every other week and also are involved in a lot of different activities that the students decide themselves what they want to focus on each year. There are 3 other clubs that might be of interest to students who want to pursue public health: Colleges Against Cancer, FIMRIC, which stands for Foundation for International Medical Relief of Children. This is a club that goes abroad once a year for voluntary service in usually a South American country. And the Food Recovery Network, which works on campus. All students at Roger Williams have the right to become a member of the Rhode Island Public Health Association for free. We're institutional members, and we'll give you more information on how to get involved in that organization once you start at Roger Williams. We're also partners with the Bristol Health Equity Zone, which is a local organization. It's a coalition in town that focuses on prevention and health promotion, and they have a number of community events that you can get involved in. A number of our students participate in those in September. And then later on in the semester, there are opportunities to get involved in public health advocacy, learning how to write advocacy briefs and policy briefs for our legislators on public health issues. And then towards the end of the year, there are 2 conferences that our students are often involved in: the Health and Society Conference and the Health and All Policy Conference. Our students have given presentations at those. So for the time being, we hope that you enjoy the rest of your summer. In July, the university will be in touch, and we'll be assigned an advisor, one of the core faculty members in the program. will help you with choosing your courses and help answer your questions that you have about what you'd like to accomplish while you're in college, what your interests are, and there will be more one-on-one kind of discussion. Until then, though, if you have further questions, feel free to contact me by email at mmcphee@rwu.edu, and I'd be happy to answer any of those questions.